Shani Sweets, the sweetest little thing in your ear. And look, I told y'all we had a full show today, and it's only right that our people, our family, Advanced Community Health, came back and is ready to sit down and talk to us about something else that's very important in the community of health. Okay, so today I have Miss Donnae Ward. Is it doctor? What is it?
Oh no, it's just Donnae.
Just Donnae.
But master's
Donnae
in nutrition, certified wellness practitioner, community health educator. But just a little bit of stuff. So
hold on, I'm gonna need you to run that back. Run that back one more time, because that was a little humble. That was a little humble. But run that back one more time.
So I have my master's in nutrition. Okay. I'm a certified wellness practitioner. I'm actually a certified personal trainer and instructor, and I'm a community health educator in terms of diabetes. So
okay, and she's a pretty girl, y'all. So she's trying to take care of y'all and look good while she's doing it. Okay, I'm here for it. All right, so this is super, super important. Like I said, she's the health equity coordinator at Advanced Community Health, and we're going to talk about diabetes. So what exactly is diabetes, and how does it affect the body?
Yeah, so diabetes is a condition when the body can properly process sugar, right? Mm-hmm. So, we have two types that people are usually familiar with. So type 1 diabetes is an autoimmune disorder. So it's actually the body attacks insulin-producing cells. But type 2 diabetes, which is more common, about 95% of the population, when we talk about the different diabetes, has type 2. That is when the body actually is just not responding to insulin, so it becomes insulin resistant, or we're just not making enough of it. Insulin is, because I like to be clear with the terms too. Insulin is the hormone that we use to break down glucose in the body. So basically, that's the two types.
Gotcha. So what are the common challenges that people face in managing diabetes? Me personally, I went to school with a guy that was, I'm talking young, like he was like early 20s. He passed away. But he actually passed away during the pandemic because of the lack of just being able to access certain things. And when you're on diabetes, like you see somebody and they need their sugar high, their sugar low, you're like, get you some food or whatever, get you their medicine. So it was a struggle for him. So what else is what are some real common challenges that people face?
Yeah, it's actually a lot of challenges. I mean, for one, like you said, that's a big one too. That's a big thing when we talk about access and the healthcare costs of diabetes, right? Because it's like you have people who are uninsured. Yeah. So if I got no insurance, how am I gonna pay for that expensive medication? So then you're thinking about that, like having to monitor your blood sugar daily, or taking your medication, remembering to take your medication, or just like the long-term management when it comes to it. So it's a lot, and then people also don't talk about the emotional toll that comes with it. It's a burnout, right?
Like they're tired, and it's always like you have to monitor it so much. It changes like your everyday life.
Everyday life, you gotta move more. You gotta count carbohydrates now, portion control, and so it's just a lot. It's a burnout. It could become an emotional burnout.
Okay, now personally, I want to know: is it better when the people are already doing healthy things, already somebody that counts their calories, already somebody that works out and stuff like that? Because I think when it happens, it's such a shock. Or depending on when you develop
you get diagnosed. If you're already doing so, it's definitely going to be easier for people who are already making those lifestyle changes, right? So if you're already managing your weight, you're already moving your body, you're already prioritizing eating more whole foods versus less processed foods, you are going to have a better outcomes in terms of how you manage the disease. But then we also got to think about the other side of that, people who are we see somebody's decision, but we don't know what choices they had. So we don't know if they had access to this. We don't know if they have the same health literacy in terms of, do they understand what an A1C is? That's the measurement we use to measure blood glucose levels. So it's you definitely gonna have a leg up if you already know. And so it could be reversed. So
that is very true. My grandma did that. She reversed my grandpa's diabetes. He developed it really late in age just because all the medicines and things he was going through. And she reversed it through her cooking, because grandma throws down.
I know that's right.
She throws down, all right? So, I would be telling her, I need the cookbook, I need the recipe. She's like, girl, write that down. Well, you need to
She said that just coming to her.
You need to start, because she definitely reversed his diabetes. So that's also a really good thing to know. So what are some other misconceptions? Because some people think you're just stuck with it sometimes. Right. What are some other misconceptions?
So that is a big misconception, that if you are diagnosed with diabetes like that it is what it is, right? So it can be, we don't say you have a cure, but it can't be reversed. You can return back to normal blood range numbers. Another big misconception that I know my people, when I say my people, I'm just talking about all of us, love to say, they love to say, oh, it run in my family.
Yeah,
so that's it.
Yeah,
genetics is only 20 to 30% of diabetes. So even if it runs in your family per se, if that is a genetic thing that you're dealing with, it doesn't mean that it's the be all. Like you will get diabetes.
I got you. What she's saying is, it's the habit. The bad habits that run in the family. That's what she said. Let's get real about
lifestyle.
The lifestyle, the eating, the not working out as much as you're supposed to, the not doing research on your body, on your family's history for their health. Like those things that it's not saying that it's just a thing that we don't want to do. It's just something that is slowly being more.
You got to change the culture.
Yes.
So we talk about generational wealth a lot. We got to change the culture in terms of generational health. Like, how do you change that? So maybe my grandfather had it, maybe the aunt had it or whatever, but how do I change that now to set the stage? Like, oh, I know I need to, now that I might be pre-diabetic, that doesn't mean that I'm going to get type 2 diabetes.
Gotcha. And
a lot of people do. A big misconception is that, oh, you get diabetes from eating too much sugar. That is actually false. So even though diabetes means that you have more glucose in the blood, that is just a risk. It is about your not moving your body. It's about a high-fat diet. It's about chronic stress. We talk about our community too.
Stress is taking us out. That stress is taking us out. It really is like the foundation of a lot of diseases.
I don't think people realize
that go on through our body. I'm telling y'all on a Pretty Girl Playbook, cut it out. Leave them alone. You put your hands up. You know what I'm saying? Like, go do something for yourself, because when you let people stress you out and you worry about what somebody got to say,
that impacts your health greatly.
It impacts your health, your mental health, your body become fatigued. You don't want to do things, and now you just, we got them shows 1,000 pounds later or whatever the case is. Well, he stressed you out that much.
You gotta let people stress you out.
Like, that's crazy. Like, ain't nobody stressing me out to 500 pounds.
Yeah, they've actually been doing a lot more research about how chronic stress could really put you in that type of health state.
Right.
With hypertension, type 2 diabetes, so many things. So so that's just a risk factor. You're not just eating sugar.
Yeah.
They say that ain't gonna give you.
You still asking them for some sugar. It's okay, y'all. It's okay. All right, now, so we've heard the many ways that patients kind of manage their diabetes, but you guys have this new program, DiaBeat. So
DiaBeat It, yes.
DiaBeat It. So can we talk about that a little more?
Sure. So this, very excited. This is actually a program I created at Advanced Community Health. So it is a holistic diabetes management program, meaning that we're looking at the whole person. So we talked about chronic stress and stuff, right? So we know that type 2 diabetes management isn't just about, are you exercising and are you, eating a balanced diet? Right. It's going to be about your mental health. It's going to be about your spirituality and your values.
Yeah.
It's just so many things when we talk about whole person approach.
I love that.
So I kind of divided it into dimensions of like access and food security, right? Because everybody's different. Like we talked about, I'm big on culture, so it needs to be culturally relevant too. Yeah. We can't come with too many European type standards when we're dealing with people of color. Yeah, so.
It doesn't work for what works for them doesn't work for us, and that's no shame. Because what works for us, maybe I don't know if you can handle it.
Okay. Exactly. So just looking at that, it's a 3-month program. It's open to patients of Advanced Community Health and the community. So, and it's going well. We're actually in our 2nd cohort.
That's so well. How do you help your patients feel supported, like through this new program, and just like we're talking to them about this new, even if they're just newly diagnosed, like how do they feel real supported?
I would think like just in terms of this program, but also I think that I shouldn't say I know that Advanced strives to create a safe space. Yeah. I think representation is very important. So if you're like, if you're seeing more people in positions that look like you, giving you healthcare advice, you're more likely to adhere to that information, if that makes sense, right?
Yeah, it's a trust. It's like you walk in with
you want to build
a little bit and have that foundation of trust.
Well, we need to build rapport because we know there's plenty of reasons why people don't have a trust in the healthcare system. So it's really important for us to build rapport and just establish community programming, right? It's one thing to like encourage them to go see a physician, but we also need things that support them in terms of like I say, whole person. Yeah. Like, let's have a conversation about this. Are you stressed today? Like, do you feel burned out? So even DiaBeat It is more of a self-care program, right? This isn't just like okay, we coming to tell you what to do. No, you the expert of your life. Right. We just provide the information for you to make the right choices for your lifestyle.
Yeah, there's no options out here. Let you know that you don't have to handle things a certain way all the time. Look, you guys, ain't nobody trying to be in your business, but we're trying to be in your business.
Right,
okay,
right.
We're trying to help you out a little bit. Sometimes you gotta open up, especially if you don't have that support system. It feels a little bit better when you're able to go to a doctor or somebody that's in a professional realm that can give you, you know, unbiased, like.
Yeah.
You know, conversations, information, and all that stuff like that, especially when it comes to taking care of your body.
And I talk a lot about health literacy because, you know, you don't want to hear a bunch of big words when it comes to your health. You just want to, you need the clear, short facts, right? No matter if it's somebody who you might say never went to school or somebody who has a master's, people still need to know, like, what do I need to do? What are the facts when it comes to my numbers, when cholesterol, anything. So we gotta, you know, provide it, just be real with the information, if that makes sense. And be empathetic too.
I love that. Yeah. Let everyone know where they can learn more about Advanced Community Health Services. And how to book an appointment.
Of course, visit advancedchc.org, right? And we are on multiple platforms. You know, we got a podcast, we got different things going on, YouTube, TikTok, Instagram. And then also call us at 919-833-3111 and they can schedule an appointment.
Love that, you guys. You know, Advanced Community Health have been coming through consistently, dropping gems, helping us understand more things, giving us access and, you know, resources. So, like she said, for more information, visit advancedchc.org or call 919-833-3111. Advances providers are here to support you and all of your health needs. All right. So, thank you, Miss Donnae.
Yes,
Donnae Ward. Definitely a blessing and like honor to have you in here because this is something that's like one of the biggest like known things in our community and it's really important. I did some of the stuff that she was saying. I was like, oh wow, because we still be stuck in like you said. Are you exercising? Are you doing this? Take the sugar out. Don't eat too much sugar. That's like very basic. So thank you for going more in depth with that. We got more with you. You know it's the Pretty Girl Playbook. I'm rocking with you until 3 o'clock. Coming up, I got Wild Lane right here on Hot 97.9. Let's go.